you to everyone who is joining us today, either here on Zoom or on our Facebook page, or who is watching this recording later. Welcome to today's Doctors In program with this month's topic of medication management. So this is our first Doctors In program of 2021, our first Doctors In program on our new Tuesday schedule. And I'll share some program dates for upcoming Doctors In programs at the end here. For anyone who is new to us at Doctors In, this is a partnership between the LGBT Elder Initiative and Jefferson, specifically the Jefferson Department of Family and Community Medicine and the Jefferson Center for Urban Health. And so we do these monthly health topics, covering a different health topic each month with Jefferson geriatricians, palliative care professionals coming in now in webinar format to share information, answer your questions. So for anyone new to the Zoom format, two options for how to submit your questions. You can put things in the chat, which I will make sure is that everyone has access to. If you put anything in the chat, it does show up with your name. You can also go to the Q&A button at the bottom of your screen. And there is an option of submitting questions anonymously if you'd rather not have your name attached to your questions for the doctors. Anyone watching on Facebook, I will be checking the Facebook page to just put your questions in as comments on the video, and I will also relay those to our presenters. So with that said, I'm going to turn it over to Olivia, who is going to be leading us in today's discussion on medication management. Her first Doctors In program with us. We're very excited to have her here, and I turn it over to you.
Great, thank you so much. I'm so excited to be here. Like he said, my name's Olivia. I'm one of the family medicine residents at Jefferson, and I actually will be doing a palliative care fellowship next year. So I'm so happy to be here. I've attended a couple of these throughout my training, and I'm really excited to give a talk to you guys. And please, everyone, ask questions. This is very informal, and I hope we can just get everyone information, and I'd love to answer questions. So just to start, some things I thought we would talk about. I'm planning on defining medications and provide some examples. I thought we would talk about safe and effective medication use, managing those side effects, things that everyone fears about medicine, talk about possible interactions between different medications, talk about adhering to medicines, making sure you're taking them as you're supposed to be taking them and the way you want to be taking them. And then something I'm not going to talk about are insurance coverage of medications. That is a whole nother topic. And really, I just hope today we can focus on some of the benefits of knowing about medications rather than if insurance will cover it or not, or how that works. So to get started, what are medications? And so I think it's a simple thing, but we should definitely talk about that. And so medicine plays a critical role in keeping us healthy as we grow older. We can use medicines to cure illnesses, to treat things, manage symptoms, improve quality of life. And I think importantly is sometimes we think of medicines just as a pill that we take, but it can be injections or patches that you stick on, creams, lotions, things like that. So I thought I'd list some medicines, and if this was, like I said, if we were in person, we would be all interacting and things, and I'd love to hear some thoughts about medicine. So if we could just take a minute to look over this list, these are all medicines, all things that help symptoms, help conditions, just help in general. So as you can see, there's blood pressure medicines, which I bet a lot of people are familiar with. Cold medicine, if you have a stuffy nose, things you take. Birth control, marijuana, chemotherapy for people with cancer, anti-anxiety medicines, insulin for those with diabetes, cough drops are a medicine. I think everyone probably just pops a cough drop when you have that cough, but that counts as a medicine. Skin creams, even things like Vaseline is technically a medicine. So I just wanted to show there's so many different types, and I'm in preparing for this lecture, I realized we say medicine, but we mean a lot of stuff. So something I thought we would go over is brand name versus generic. And I'm sure everyone here has heard there's the brand name and then just the regular name, but what really is the difference? And so some examples, just to familiarize everyone, is if you hear Benadryl, well, the generic name of that is diphenhydramine. Lipitor, which is a medicine for cholesterol, is called atorvastatin. Coumadin, a blood thinner, warfarin. Flonase, the nasal spray, is fluticasone. Lasix, a water pill, commonly known as, this can be generically known as furosemide. And then Prilosec, which is for acid reflux, is generic is omeprazole. I thought this chart did a good job of explaining the difference. And as you can see, the big thing is that the active ingredient, which is the part of the medicine that actually is treating what the problem is or the symptom that you want to target, there is no difference. So often I tell people a lot of times if they have allergies, seasonal allergies, you hear Zyrtec, Claritin, Allegra, things like that. I say, look at that package, see what the active ingredient is, and then buy the generic version of that. And so the difference really is that there's no difference in active ingredient. Often brand names are higher in cost, similar to brand name clothes or Kleenex or paper towels. They're more expensive. I said I wasn't going to talk about insurance, but a little bit, sometimes insurance won't cover the brand name. The big difference is that it used to say that in the inactive ingredients, so the things that make up the capsule of the medicine or some of the binding agents and creams, can be a little bit different in generic versus brand name. And again, if you kind of think about it in terms of a paper towel, it does the same thing. A paper towel wipes up the spill, but some are different in terms of what makes them up. And if they work better or worse, is I think less in medicine than it is in paper towels. So I usually say if your doctor says, hey, this is the generic form of this is safe to take, then it's definitely safe to take. Often we talk about medicines by saying the brand name for two big reasons. One, as you can see from this list, they're just easier to say. It's easier to say Lipitor than atorvastatin. And two, they're just more commonly known. And so sometimes just to facilitate better communication, we'll talk about the brand names, but generic medicines are great medicines, and often I encourage patients to use the generic medicines. Anyone have any questions about this? I think it's a big topic and pretty interesting in my opinion.
Is that something, Olivia, that you would recommend people ask? If they're not offered a generic, do you recommend asking if there's a generic?
Yeah, that's a great question. I think we'll talk a little bit more later about over-the-counter versus prescription medicines. Often a prescription, if the generic exists, that is what will be given to you based on, again, insurance coverage and availability. But I think the underlying message of this talk is going to be always ask your doctor or pharmacist any questions. So if you say, hey, is the generic or the brand name different? You should definitely have that conversation with your doctor. There's very few medications, and there might be in the specialty things like the chemotherapies and really specific medicines where there is a difference. But in general, like I listed here, these really common medicines, there is no difference, and the generic versus the brand name are safe to take. So kind of leading myself into it, over the counter versus prescription. I'm sure everyone has heard this, oh, you can just buy that over the counter, or oh, you need a prescription. And so really, over the counter means that you can buy it at the pharmacy. You don't need a specific prescription with your name and specific directions on how to take the medicine. So things like Benadryl, you can buy over the counter. Allergy medicines, you can buy over the counter. But you can't buy insulin over the counter. You can't walk into a pharmacy and say, hey, I want some insulin. It doesn't work that way. And the way that's regulated is all different. The FDA and different kind of big companies decide what needs a prescription and what doesn't. And it really comes down to overall safety, as well as, again, communication with how to take a medicine. Tylenol, you can buy it over the counter. You can also get a prescription for Tylenol, which makes things, I think, sometimes confusing. So I thought we could go into more detail. Over the counter, like I said, sold directly to a consumer, who's anyone buying it, without a prescription from a healthcare professional. Multiple people can use it from the same package. I don't know, I keep a bottle of Advil at my house, and anyone who needs Advil, I'm like, hey, anyone needs some headache medicine? So anyone can use it, and that's fine. Advil, Tylenol, cough medicines, Robitussin, Mucinex, allergy meds, exactly the things I said. These are common things you can buy in common pharmacies. Versus a prescription, which again, legally requires a medical prescription to be dispensed. And it is specific to the person whose name is on the prescription. So if you have a prescription for, again, I'll use the example, insulin, and you say, oh, well, my niece also has diabetes, she can use my insulin. No, do not do things like that. These are specific medicines that are specific to you. Hydrochlorothiazide, lisinopril, you might have heard of. Those are blood pressure medicines, diabetes medicines, like I said. Some pain medicines like opiates or higher doses of things like Advil. NSAIDs there means non-steroid. I don't know all the letters there, but they're things like Advil and aspirin. So sometimes higher doses of those require a specific prescription. And again, this is all having to do with safety of the medicines. So it's difficult to cause harm with over-the-counter medicines. You can accidentally take them too close together or a little bit wrong, and you'll be okay. It's not good, but it'll be okay. Versus a prescription requires a longer conversation with your doctor or pharmacist and make sure you're using it correctly. Most people have a combination of both of these in their life. Most people take over-the-counter and prescription medicines as they need, but that's kind of the difference in terminology. If you're with your doctor and they say, oh, you can just buy over-the-counter Vaseline, that means you can just walk in and buy it. Or if they say, oh, I'm going to prescribe you something, then it's specific for you. Any thoughts or questions on prescription versus over-the-counter?
I just would chime in, Olivia, that it's important to tell your healthcare team about both, because even though over-counter medicines may be relatively more safe, they can still interact with your medicine. So your providers do want to know even about the over-the-counter ones.
Definitely. Dr. Salzman, that's a great point. Whenever somebody says, what medicines are you on? If you're taking a over-the-counter cough medicine, include that, a vitamin, anything like that, definitely. Okay. So we talked about what medications are and how you get them. And next I thought we'd talk about how do you know how to take them? And so again, the kind of big point I'm going to hammer through is discuss with your pharmacist and your doctor. If you ever have a question, if you forget, if you don't remember, definitely just message, call, and say, hey, I forget how to take this. What was I supposed to do? Before you kind of make a mistake that could be really harmful. Read the labels, which we're going to go over because those labels have a lot of words on them and a lot of things. So I'm going to walk everyone through how to look at a label to read and make sure you're taking it correctly. Also, if you go to the hospital or if you go to the outpatient office, you often get some paperwork with you, a discharge paperwork or after visit summary. And usually there's a list on there of your medicines, any new ones that were added or your old ones, and they tell you how to take it. So I thought we'd go over again the over-the-counter, and then we'll go over a prescription label next. So this over-the-counter label. So I thought this was a nice diagram that we can take some time to look through because it kind of highlights these 7 different sections of a label. So I don't know if anyone's home and they want to take out a bottle of anything they have and look at the label too. This is just a example of Tylenol that we'll talk through. So number 1 here, drug facts. So here it shows the active ingredient and the purpose. So as you can see, the active ingredient is listed as acetaminophen, and it tells you the milligrams, which is 500. So this is that generic name. So that is Tylenol is the brand name, which we all know, but acetaminophen is Tylenol. And as you can see under purpose, it says pain reliever and fever reducer. So this is how you know this is what this medicine is. This is how many milligrams in each capsule, and this is what I'm taking it for. Then under number 2, it says uses. So purpose and then uses, what you can use it for. And it can give you some ideas for that. So making sense with this one under Tylenol is, you know, muscle pains, backache, toothache, headache, and then it temporarily reduces fever. So I like to call this as like the uses is what am I really taking it for? So I know it's purpose, but what are some things I can take it for? Then number 3 here is the warnings. And this is where I think everyone gets a little bit overwhelmed and kind of scared, because you have to, as a company, they have to put everything that could possibly be on this side. So again, it's important to talk to your doctor about what the warnings and possible side effects relative to you as an individual are, and what are just the general side effects of a medicine. But again, this shows the side effects, the drug interactions, when to stop using it, and when to talk to a doctor or pharmacist. Often it'll have things about an allergy here, which is important to know. If you take a medicine and all of a sudden get very itchy, you can flip it over and see, am I supposed to have this, or is this a problem? Most of the time, itchiness after a medicine is not the intended effect. And so this one notably says, do not use with any other drug containing acetaminophen, prescription or non-prescription. So some medicines that you buy over the counter, cold medicines, have some active ingredients from different medicines in one capsule. So you don't want to take a cold medicine that has acetaminophen in it and acetaminophen by itself. So that's why it's important to look at those active ingredients and make sure you kind of look at what you're taking. The 4th step over there, directions, tells you how to take it. That's often, when to take it, how many tablets to take, which is what we call the dose of the medicine. So here you can see this is clearly an adult Tylenol, because it says adults and children 12 years and older. Take 2 caplets every 6 hours while symptoms last. And it says don't take more than 6 capsules in a 24-hour period. So I think it's important here again to recognize that over-the-counter medicine is general. This is for a general person age 12 and older, not specifically you. And so maybe your doctor told you to only take no more than 4 caplets in 24 hours because they know something about your health that makes this medicine different, which we'll talk about in a little bit. But in general, you want to stick to these directions when you're buying over-the-counter medicine. Other information, it tells you to store it at that temperature. To be honest, if you buy it over the counter, it can usually just last in your house. But things like, when we'll talk about prescriptions, insulin might need to be kept in a refrigerator. And then the inactive ingredients is that part that I said can vary between different generic brands. I honestly don't really look at this, but if you have an allergy to something, you might want to look at this. If you can't have cornstarch, then you don't want to take this medicine. And then interestingly, they always have a question or comment section on the label. So I think you could always call that number, but I would say your default question should be your doctor or your pharmacist. So like I said, there's a lot going on in this label, but I think if you break it down and think about the big parts you really want to look at are going to be, I think, the drug facts to look at the ingredient, the medicine that you're taking, and then number 4, the directions about how to take it. Any questions about this kind of label? So next, then we can talk about, was there a question?
This actually wasn't pertaining to the label. I think this is actually going back to the talking to your doctor about other things that you're taking. Someone had just put in the chat to also talk about any herbs or herbal supplements that one might be taking.
Definitely. And we'll get to that too in a little bit. So prescription label. So as you can tell, it looks different than the other one. This is kind of flattened out. So if you have a prescription bottle with you that you can look at now, it's usually curved around the bottle. And I think they're sometimes very hard to read on that curve, and they're really tiny. So this is blown up again to show you all the different parts of this kind of label. So if we look kind of in the middle, and then we'll work our way to the outside. So the middle there, it says metformin, 500 milligram tablet. So metformin is a diabetes medicine that people can take for their blood sugar. So in the middle there, it should say the medication name and the strength. Again, this might say the brand name or the generic, depending on what the pharmacy dispenses. Usually underneath that, it tells you how to take it. So here it says take 1 tablet orally 2 times a day. And then on the side, it has this picture here, as you can see, with morning and evening, midday, and bedtime. Different prescription labels look different. And this is a great, I think, opportunity to ask your pharmacist as well. They can put different stickers on it to help you. They can write it down in different ways to really make sure you're taking these medicines when you're supposed to be taking them. Similarly to over-the-counter medicines, they'll have important information. So things here like side effects that you might see or when to call your doctor. There's a barcode on prescription medicines as well. And then I think importantly is the pharmacy information. So it lists the pharmacy, who wrote the medicine, so the prescriber. So if I write you this prescription for metformin, my name will be here, when you got it filled, and often on here too is how many refills you have left. And so refills are an interesting thing. A lot of times providers will write prescriptions with X amount of refills. For example, if you've been on the same blood pressure medicine for years, your blood pressure is well controlled, often your doctor will write you a prescription for a year and you can either get it monthly or every 3 months with refills. That means when you're running low on medicine, you call your pharmacy and say, hey, I need a refill, and they'll be able to refill it without getting in contact with your doctor because you and your doctor have already decided this is a good medicine for you for a year. Sometimes when we're working with, we call it like titrating, but making sure we're at the right dose of medicine to give you the right effect, we'll only prescribe 2 weeks, a month, 2 months, and no refills because we want you to come back and see us before we change the medicine or give you more refills, or we want to make sure that it's working the way we want it to work. So we never want patients to run out of medicine. That's not why we don't put refills on some medicines. We just want to make sure that we're having those conversations before we send refills and make sure it's working the way we want it to work. Any questions about prescription labels? Okay. These are the stickers that can sometimes be on prescription labels. Take with food, or here, this one is just noon in big letters. So I guess you must take this medicine right at noon. This one is important. If it with alcohol can impair your ability to drive, or this one, keep out of reach of children. I would honestly say most prescriptions and all medicine should be kept out of reach of children. And so I know, especially now with a lot of kids being home from school and learning at home, our home situations have changed significantly, and we want to make sure medicines and things that we don't want other people to accidentally get into are either stored high or locked away, really only, again, intended for your personal use. Some medicines on these will say that you have to take it on an empty stomach. Some say with food. Again, you can always ask if you need clarification on that. Today, I prescribed a patient a medicine that she only has to take it once a month. And I said, you might forget how to take it because you're only taking it once a month. So I wrote it really big on a piece of paper for her. I said, take once a month on an empty stomach with a big glass of water. And so I think sometimes when we take medicine every day, you get in the routine, but some medicines are weekly, some are monthly, and it can get a little bit confusing. Other questions? All right, so if you're taking medicines, we always have a desired effect of fixing something or making something better, healing something, but there are these things called side effects, and I think everyone hears, oh, what's the side effect of that medication, and worries, what is the side effect of that medication? It is always a good question to say, hey, what are the side effects when your doctor or pharmacist is giving you a new medicine? I like to say a side effect is an undesirable secondary effect that occurs in addition to the desired therapeutic effect of a medicine. So this can occur after starting a medicine, stopping a medicine, changing a medicine, or sometimes can happen at any time. There are some side effects that we know and that we expect to happen, and we can talk about those before we prescribe it. And there's some that are less likely to happen, but might happen. And so again, if you ever experience something that isn't the desired outcome of the medicine, you should take a pause and think about that. A side effect is very different than an allergy. And this is something I really wanted to clarify. So an allergy is, your immune system creating a reaction to the medicine. So I think most commonly people hear, oh, I'm allergic to an antibiotic called penicillin. It's a very common thing we hear. And often kids took it when they were little for an ear infection or a throat infection, and they broke out in hives and a big rash. And then people said they were allergic to it, and they've never taken penicillin again. So an allergy is not a side effect, that's a true allergy. And there's a kind of big range that we don't have to get into today about what an allergy is. But I wanted to talk about side effects, and then I'll give another specific example. So side effects are not allergies, but they can be things like constipation, dizziness, dry mouth, insomnia, where you take a medicine and then you just cannot fall asleep. Swelling of your legs, that's a very common one with a blood pressure medicine called amlodipine. You can have GI upset, changes in your appetite, and then worrisome side effects can be kidney and liver damage. So I listed here side effects, and then adverse events is kind of the fancy word for things like that. And again, this is why you have to have open communication with your doctor and your providers about what's going on. If you don't say, hey, I took this medicine, but I've been really constipated, then we don't know and we can't help you with that. And so you definitely have to let us know what's going on when you're taking a medicine, how you're feeling. So what do you do when you have a side effect? That's kind of the big question, right? So sometimes nothing and sometimes something. So I'm going to talk a little bit later about, we don't often want to just keep treating side effects with other medicines. That kind of sends us down this spiral of just treating things for the sake of treating them when we're not thinking back to the original source of what's going on. That said, if you have chronic pain and you're taking an opiate pain medicine, a common known side effect is constipation. Similar, iron pills can cause constipation. So if you have low hemoglobin, low iron, and you need to take iron pills, you can get constipated. We know that, and we know it happens to most people who take those medicines. So typically when we prescribe those medicines, we also prescribe or recommend you take a stool softener like Miralax. That helps you get the desired effect, which is either, in this case, the pain relief or the iron supplements, without having the constipation. You do not need constipation to benefit from those medicines. Things like dry mouth, we can recommend some different like mouth washes and water swishes to kind of help you feel better. But the big thing, again, I'm going to say this a million times, but it's just talk to your doctor or your pharmacist about what's going on when you take a medicine. Here's a specific example that I hope is relevant. Cold medicines and blood pressure medicines. So if you have the condition of high blood pressure, if you've ever been told your blood pressure is high or you're on a medicine for it, something to look out for is when you have a cold, you want to just reach for one of those over-the-counter cold medicines. But it's notorious that the way those cold medicines make you feel better is they kind of constrict your blood vessels, like in your sinuses and your nose up here, so that you're not as congested feeling. But those cold medicines aren't very smart. They don't know just act on my vessels up here. They act on all of your blood vessels. And so that can kind of constrict all your blood vessels, which then leads to higher blood pressure. So luckily for us, because we know this happens, pharmacists and medical scientists develop medicines that work better for people with high blood pressure. So an example of this is, I always say this name wrong and people kind of laugh at me. I don't know if it's coricidin or coricidin, but anyway, it's that commercial, it's like HBP. But this is intended for people who have high blood pressure and have a cold. So it avoids that kind of decongestant ingredient, which is something like Sudafed or pseudoephedrine, ephedrine, phenylephrine, things like that. If you have high blood pressure, you want to avoid. And again, it's because these medicines aren't as smart as you. And so you know, hey, I have something that might make, if I take this medicine, it might get worse. So this is an example of that. Okay, so kind of going off of that, are all medicines safe to take together? I think this is a great question that we need to explore. Different medicines need different things. So timing and absorption. So I know somebody brought up herbs and supplements. This is important because if you take herbs and supplements at the same time as your other medicines, it can affect how your other medicines and the supplements are absorbed. A good example of this is a thyroid medication. So if you take a medicine called levothyroxine or Synthroid, that medicine should be taken again on an empty stomach so that it gets absorbed and doesn't have food or milk or anything like that impact its absorption. And that's so your body can get the full effect from that medicine. Other medicines you have to take on a full stomach because the way they get digested into your system, they need that extra blood flow to really get pulled into your system. Things like iron and calcium are two very common supplements, but also are two things that can interact with different medicines. So if you're taking iron or calcium and your doctor prescribes you a new medicine, again, just say, hey, I take this. Does that make a difference? Again, some side effects can add up. So things can cause heartbeat abnormalities or hypoglycemia. So if you have diabetes and you're taking a medicine to control your diabetes, but we give you too much or you stack too many, you can have the unwanted thing of hypoglycemia, meaning your blood sugar drops too low. So if you're taking insulin and a medicine maybe called glipizide, we watch for hypoglycemia, low blood sugar, or heartbeat abnormalities, things that can make your heart beat too slow or too fast. We have to pay attention to what we're doing to make sure we don't get that unwanted effect. There's also this thing that we watch for, and especially when you're in the hospital, and it's your heart rhythm. If we know some medicines can do this thing called QT prolonging. I don't know if anyone's ever heard of that, but it's not something to worry about on your side. We'll take that burden of worry, but we don't want to prescribe too many medicines that potentially could make that interval of your heartbeats longer, because if we give you too many, then the likelihood of that happening is higher. So we pay attention to that, okay? The last big thing are ingredient interactions. So two big ingredients are grapefruits and leafy greens. So grapefruit has this enzyme in it that can interact with different medicines, in particular, cholesterol medicine and grapefruit. So try not to eat a big grapefruit while you take your cholesterol medicine. It's okay if you have a grapefruit later in the day or take your cholesterol medicine at night and you have a grapefruit for breakfast, but you just don't want to take them together. And things like leafy greens and broccoli and collard greens are really big in terms of that blood thinner Coumadin or warfarin. And so often people who are on those medicines even know better than their doctor sometimes why their numbers are off. They'll be like, oh, I had a lot of collard greens over Thanksgiving or something like that. And so as long as you're aware of this, you can know you can still enjoy your different things, just want to make sure the timing of them is correct.
One of the questions, Olivia, that someone had sent me before the program, but kind of on this topic of interactions and supplements, but thinking specifically about calcium supplements and vitamin D. And I think the question being, are those things that would worry a medical professional that those could interact with new medications? Is that something to be watching for? Are those in general good supplements? So anything you can say on those topics?
Sure. Supplements is a huge topic, and I have to be honest, I'm not an expert in supplements. Typically, my general kind of philosophy are supplements are, I don't really know them. They're not regulated in the same way that prescription or over-the-counter medicines are regulated. Most of the time, they are not going to cause harm, but I can't say how much benefit they can cause either. In particular, though, with vitamin D and calcium, those are great to talk about. Calcium, I think typically most people get enough calcium in their regular diet if you think about what most people eat. However, we definitely order blood tests to test electrolytes. Usually when we say, oh, we're going to test your electrolytes, that includes calcium. And if you're low in calcium or if you're low in potassium, magnesium, things like that, then we will recommend supplementation, which can be provided again in a prescription, which is meant specifically for you, or we can tell you to buy it over the counter. So I think calcium is fine. You don't necessarily need to take more, but it's really good for your bones. And I think that's probably where this question comes from with calcium and vitamin D, which are both good for your bones. The way we know if you need to take it or not is we test those levels. And also, we do something called a DEXA scan. I'm not sure if anyone here has had a DEXA scan, but that measures your bone health. And that can tell us if your bones have osteoporosis, another very common word, which means your bones are more brittle than we would like them, or osteopenia, which is not all the way to osteoporosis, but not normal bone health either. Vitamin D, is really common for people to be low in vitamin D, and often we will provide vitamin D supplement. Again, I think vitamin D and calcium supplements are fine, but I'm just going to stress this more. Individually, you have to talk with your doctor specifically to you. Are those supplements going to interact with any medicines that you're taking or conditions that you have?
Great, thanks. And someone else just made a comment, and I'm going to turn it into a question.
Sure.
But the comment being feeling like every year they end up having more and more tablets or supplements or medications. And so I was just curious to see your reaction to that. Is that typical? Is that something that you would maybe try to work with someone to get them on less medications? So any advice for people feeling like they're just getting more and more meds as they're growing older?
Yes, that is a great question, and definitely what I'm on my way to in this talk. So I'm going to table that for now, but we'll get to that for sure.
Great.
Kind of within that, different ages have different responses to medicine. And so the way as our body ages influences how medicines our body absorbs them. So typically, just as a little the science nerd in me, most medicines are broken down in either your liver or your kidneys. And again, this is something we as your doctors pay a lot of attention to. If you have kidney problems, we try to avoid medicines that put too much stress on your kidney. If you have liver problems, we do the same thing there. But the circulation, so if you have heart problems or leg problems, impacts the way medicines are absorbed, and then body composition. So as we age, unfortunately, we get typically less muscle, more fat tissue, and the water content of our body also changes. And this can affect the way medicines are absorbed. That's why different people of different ages need different doses of medicines. And it can be really common to say, oh, well, I have the same problem as my cousin, but my cousin is 32 and I'm 72, and we don't take the same medicine. And that is, again, because your bodies are just plain old different, which is fine. I thought this picture is kind of interesting. It shows you all the different ways that medicines can be absorbed or affect your body. So if you go from head to toe, so in our brains, there's brain receptors that matter. So things like anti-anxiety medicines, anti-nausea medicines, depression medicines are more affected in your brain. Circulation, I talked about with your heart. So anti-blood pressure medicines and different heart rate rhythms. Metabolism, I talked about the liver and kidney, but also your stomach and your intestines. And so one thing in particular is as you get older, your GI tract, those gastrointestinal tract, is more susceptible to having the bad outcome of a GI bleed. I'm not sure if anyone here has experienced that or known anyone to experience that, but it can be both painful and pretty scary for other people to just have some bleeding from your gastrointestinal system. And sometimes higher doses of medicines can aggravate that and make that happen. So for example, if you think back to when I was showing you all those labels, and I told you your doctor might tell you that they only want you to take a maximum of 4 pills a day, but someone else can take 6 pills a day. That's a big reason why. So things like Advil or naproxen, meloxicam, those kind of medicines, if you've heard about them, we try to avoid high doses of those in aging people because we worry about that the side effect is going to outweigh the benefit of the medicine. And so that's a big conversation. We always talk about risks and benefits, and anything in medicine is really a risk benefit conversation, which is why I like it. But you have to talk about, are you going to get the benefit or are you going to have too much of a side effect that the benefit doesn't even count as a benefit anymore. So this is where I was going to talk about all these medicines and all these things. We call it in the medicine world polypharmacy, being poly is a lot and pharmacy being medicines, but basically it boils down to too many medications. Now, in medicine, there's kind of different ways that we define what polypharmacy is. Sometimes in the literature it says more than 5 medicines in general. I like to think about it personally as, is it more than you need? Are we causing you, again, more of a burden than we are helping you with our medicines? If you're taking 7 different medicines, but you feel great and you are able to take them and you understand what's going on, that's fine. If you're overwhelmed or 3 medicines are causing you problems, and that's not the right number for you either. So again, I like to say this is really individualized. There is something called this medication cascade. Again, this is in the medical literature, but this is where I was saying, if you have a side effect from a medicine, then we give you a medicine to treat that side effect. Well, if the medicine to treat the side effect has a side effect and we give you another medicine to treat the side effect of the side effect of the side effect, then we just keep spiraling into this situation where all of a sudden you have all these things, nobody knows what they're for, and it's not, again, helping you. And I think it boils down to all of your doctors, your nurses, your pharmacists want to make sure we're helping you in the best way we can. So I put a big X through this. We do not want polypharmacy. Something that's interesting is there's actually this list of medicines called, it's called the Beers criteria, and we learn it in medical school and we talk about it all through our training. And it's medicines specific to the aging population that you either want to try to avoid because of the different things I talked about, that it might not be absorbed in the way we think it will in aging bodies, or it causes side effects like low blood pressure or dehydration that are made worse with aging. So if you think about someone who's older, maybe not eating as much because they're not as hungry, versus a 20-year-old football player, athlete eating all the time, we don't want to give the older person a medicine that's going to dehydrate them when they're not able to kind of replace that. And so we always have to be paying attention to what's going on and how we can best help you. If you ever feel like, hey, I think I'm on too many medicines, definitely bring them all into your doctor. I'm going to talk about that next, but really it's so important. To every appointment, I tell my patients, bring all your medicines, bring all those bottles, put them in a bag so we can look at them and say, hey, are you taking this one? Are you taking this one? How many times do you take this one? So we can both make sure you're taking the right medicines in the right ways, and so that we can kind of help clarify. And if you say, I take this one, but I don't feel better when I take it, then maybe we can discuss, do you really need that medicine? Does that answer, or anyone have any other thoughts about taking too many medicines? I know I sound like a broken record, but this is so, so true. Communication, I think, is the key to successful aging, living, everything. We talk to you, we talk to the pharmacist, and it's just this nice little circle of communication. If you have a lot of medicines, if you have 1 medicine, if you have 3 creams, you got to stay organized and keep track of them. And I think the biggest and best way to do this is have a routine. If you always take your medicines at the same time in the same situation, you're going to remember to take them. You're going to minimize the side effects of if you forget to take one and have any kind of symptoms from that. But that said, there's a lot of ways to stay organized and have a routine. So I thought we could go over a couple of those. So the first is the classic pill box, which I'm sure we've all seen. I looked these up on like Google and Amazon, and they have some very high tech ones. If you look at this one here, there's like each day and 3 different sections per day. Or this one just has AM and PM, and this one is just daily. I think something important about this one though is you have to make sure that you fill it at every week and you fill it correctly if you're just gonna take all the pills that are in that little pouch. I think often it's nice to have a buddy who can help you, or again, you can even bring this into your appointment and have someone in the office help you fill your pill box so that you're taking all the right medicines as you're supposed to. There's also now with technology, amazing apps that are great if you're good with technology or if you can manage this one, Mango Health. I looked it up and it's really impressive. It sets reminders. It shows you what the pills look like. I think that's something that is difficult in terms of good communication between patients and providers is sometimes my patients will be like, oh, I take the, little white one 3 times a day. And unfortunately, I don't know what the little white one is. And different pills can look differently, different times you get them. And so it's important to keep a list of the names and the doses. So these apps, these are some that I just looked. Another good thing are phone alarms. I think often we tell young people if they're on medicines, specifically like birth control or something you definitely don't want to forget to take, to set an alarm on your phone and so that you remember to take it. And you can do the same thing with your medicine. Say, hey, I need to take my insulin or something like that. Set an alarm on your phone. Then I think another great thing, and I used to do this for my family all the time, is just carry either a list. I know it's kind of old school, but a list in your phone or a list on paper of the name, the doctor's name, who prescribed it, when to take it, and when you started it. This is good for if you are on the fly and forget and need to show it to someone, or, in case of emergency, if you carry this in your wallet or in your purse or something, someone can look at it and know what medicines you're on. So I think it's always good to have something like this. This is like a bigger sheet as a template that I thought maybe we could distribute somehow after this talk if somebody doesn't have one or wants to copy this down. But I think having a list like this is good. Again, it's important to keep it updated. So we know medications and times you take them and things change. And so anytime a change is made, just make a little change on your sheet so you have an updated sheet. Kind of to wrap it all up, and then I'd love some questions. I thought this was a great visual of kind of my 5 big tips. So number 1 though is try to bring your medicines to your appointments. I know it's sometimes hard to remember, but if you're running out the door to your appointment, just throw them all in a bag so we can look at them and make sure that you're getting the right medicines that we want you to have. I think it's great for you to read up on your medicines, know what you're taking. As doctors and pharmacists, we do our best to recommend the best medicines, but often nobody knows you better than you. And so for you to know your medicines and your conditions is so important. Take them the way you're supposed to take them. Keep the records, like I said, watch for changes. And so if something changes, let's say take your New Year's resolution and really are going to the gym and you lose a lot of weight in the next couple of months, and maybe one of your medicines is making you feel different. Well, it's very possible that it's being absorbed differently because your body has changed. And so it's good to make note of that. And again, talk to your doctor about that. So yeah, that's all. These are my references. But that's really all I had. If anyone has questions or comments, I hope this was helpful. As you can see, medications are complicated and there's a lot of thought that goes into them. But I think my biggest takeaway point is that when we prescribe medicines or recommend them, it's really because we think they're going to benefit your health and we want you to get those benefits.
Awesome, thank you. We might have to put the Peanuts image in our Doctor is in marketing from now on. That's great.
It's perfect, right?
So I have a couple of questions that folks have submitted, but as I'm reading off those, if anyone else has questions, put those in the Q&A box or in the chat or in your Facebook comments. But so one that I had gotten is, and so this was with an example specific to acid reflux, but I'm sure it could have similarities with many different health conditions. But this individual saying that with acid reflux, the medications that they've been prescribed over the years keep on changing, and that word is that some of them are now considered dangerous. So just curious to hear your thoughts on that of both keeping track of what medications are the right ones to be taken if you have taken different types of medication for one condition. And I guess just how to keep track of what's safe to be using.
Sure. So medication recalls are super common and super kind of mainstream media. And I think often the pharmacy will call if you're on one of the medications that are recalled. my general advice is if a medicine is recalled and you are on that specific medicine, before you just stop taking it totally, talk to your doctor, because you don't want to accidentally cause just like an abrupt stop of a medicine. And really, when a medicine's recalled, it can be for many different reasons. It can be one of the inactive ingredients is found to do something wrong. I think the acid reflux medicines, I think Zantac is the one that was recently recalled, and it was one formulation of the Zantac. And so once all those were pulled from shelves, it was re-put out safely. So that's possible. It's hard. I mean, it's really difficult. And I think, again, it comes down to risk benefit conversations. And I think anytime a medicine is recalled, similarly to a car, when a car is recalled because of a broken part, you kind of need to get that fixed before you can keep going. And I think that's the same in a medicine. If a medicine is recalled, you have to take a step back, think about what's going on, and then possibly need to move forward. That said, things like acid reflux or allergies or insulins, we have a lot of different ones at our disposal, at our use. And so often switching from one to another isn't that big of a deal. It can usually have a similar side effect profile, the same benefit. And so it's really not something to super stress about. When you get into the more specialized medicines, it could potentially cause a difference. But also, I'm trying to think back. There was a blood pressure medicine that was recalled, the sartan class, if you have that, and we just kind of switched people to different medicines, and you were still able to control and help their blood pressure. So again, it's going to come down to that conversation, but it's important. That's that number one point of staying in tune with your health and paying attention.
And there's actually another question that came in about recalls. So I think you.
Oh, perfect.
But obviously something that's on folks' minds.
Yeah.
There was another question here about moving from an injection to taking the same medicine in a tablet form. And in this case, it was specific to Ozempic. But I guess in general, is that plausible? Is that difficult? What's sort of the process? Are there benefits that you're getting from an injection that you're not going to get from a tablet? So talk through that.
Yeah, that's great. And that again goes back to the different medicines in different forms. And so for some people, it might be easier to take an injection once a week than take a tablet once a day. For some people, needles, no thank you. And so you kind of work for the pill form. Some medicines like insulin, unfortunately, are an injection, and that's the only way right now to get that specific medicine. I think if there are medicines available in different forms, and you have a preference or you want to know about them, it's going to, again, that conversation with your doctor. How does this look for me personally? I honestly don't really know Ozempic versus the tablet form. I would have to do some more research and look that up to better counsel a patient. And so I think just with the prescribing doctor, also realizing that I mentioned how many medicines during this talk, and I didn't even cover probably an eighth of what exists. And so sometimes you might not get an answer right away. And I think when a doctor or pharmacist says, let me get back to you, that's actually a really good thing, because that's showing that your doctor wants to make sure they're giving you the right information and looking into it to keep you safe. So like if that question came up to me today in clinic, I would have to say, I'm not sure. Let me look into it and get back to you. So I think it's that conversation and those risk benefits.
Other question that I wanted to ask. So we had done a Doctors In back when in-person programs was still a thing, but on chronic pain, and had some discussion in that one about pain meds and the fact that there are concerns with either addiction or tolerance. And so I was just curious if you could talk a little bit, sort of what your framework is around prescribing medications for pain that could have addictive qualities.
Yeah, that's a great question. And I think something that I really like about my job in family medicine is that I get to know my patients. And I think that's the biggest part, is that you develop that relationship with your patient and kind of what their situation is, how you're going to help them the most. What I say is, it's hard to generalize classes of medicine. So you hear opiates and you kind of get this now fear because everyone knows that opiates are an addictive pain medicine. That said, they're often very appropriate ways to treat pain. And so I think when I prescribe medicines that do have addictive qualities to them, I'm very honest with the patient and say, this does have an addictive quality, but let's do it in this way. And so I'll prescribe it. I won't give 12 refills, for example. I'm not just going to say, you can call your pharmacy and get this whenever you need. Usually I'm going to say, hey, we're going to check in every 2 weeks, every month, and see if it's working, how it's feeling, and I'll give you more as you need then. And that way it keeps you safe, because you're communicating with your doctor. Another medicine that I think is common that has those addictive properties associated with it are sleeping pills or sleeping medicines like Ambien, for example. And again, I typically only give patients a few of them to see if it helps or if it doesn't help, and then we can reassess. There's also, I think, a lot of medicines and a lot of things like even therapy or physical therapy that can help before you need to kind of pull out those big guns. And so you can try lesser strength like medicines, less potent but more frequent, to see if that controls your medicine or your pain. There's all those different forms. So you can take an oral pill, you can do physical therapy, you can put on a topical cream, and those kind of things are going to help before you necessarily get to the addictive medicines. But once you do get to that point, it's again that risk benefit. Is the risk of addiction less than the benefit that you're going to get from the medicine?
Great, thank you.
Yeah.
So I think we are right at 2 o'clock, and I think we have covered all of the questions that had come in. So we're going to wrap it here, but want to give a big thank you again to Olivia for the presentation today, and for all of you for joining us. I wanted to just share dates for upcoming programs. So as mentioned, we are moving to a Tuesday afternoon schedule. Previously, I've been doing Wednesdays, but so it's going to be the second Tuesday of the month for the rest of the winter and into the spring. So February 9th is going to be our next program, and that's going to be on heart health, cardiovascular issues. In March, we're talking about exercise. April will be on mental health. May is going to be on bone health, so issues of osteoporosis. And in June, we'll be talking about dementia and dementia care. So definitely hope you all will come back to join us for some of those, and we'll make sure that you get the announcements and how to register when those programs are upcoming.